Hi, my name is Morgan. I'm your student nurse today. It looks like I have physician's orders here to change your chest tube drainage or your dressing, and the physician is here and we're going to get you hooked up to suction and your drainage system. So can you tell me your name and date of birth?
Abigail Wagner, February 15th, 2003.
And do you have any allergies?
Nope.
All right, I'm just gonna check your band here. That looks good. I'm gonna pull the curtain and provide privacy, and I'm going to perform hand hygiene. So now I can go ahead and put on clean, non-sterile gloves. And I have my clamp here. We're gonna clamp this off to start with. And then we can go ahead and hook the tubes together, so thumb to thumb. And this goes down to my system here. And I would turn suction on. So now I can take my gloves off and I will perform hand hygiene again. And I can begin opening my sterile field. Anything hanging off the table or within the 1-inch border would not be sterile. And for the purpose of this video, my supplies are no longer sterile due to limited resources, but for this purpose, we will pretend that they are sterile. So I can go ahead and begin opening my supplies. Okay. So now I can go ahead and touch my sterile field now that I am sterile and manipulate any of my supplies that I may need. So we're gonna fold the petroleum gauze the long way here. And I'm going to sacrifice my right hand to hold the tube in place while we do this. So I can go ahead and begin with the petroleum gauze. And we're gonna wrap this around here. Pretending that this piece of paper isn't in the way here. we are no longer sterile. So I can go ahead and touch this, and we are going to put the Metafoam tape, normally 3 to 5 strips on top of this here to make a nice seal along the skin. And we would put strips over the entire thing here. And you can also tape in place if you want, just for a little bit more security, although this will be sutured in place. So now I can go ahead and assess any of the old dressings to see if there's any signs and symptoms of infection, what the drainage looks like, and make sure that everything is intact. I will check the drainage tubing to make sure that there's no dependent loops and no kinks, any blood clots or anything blocking our path. And I would check the skin around the site for subcutaneous emphysema, which would feel like Rice Krispies under the skin. And I'm not feeling any, so that's good. And then I can go ahead and explain my system here. This is my drainage collection chamber. You're going to want to check this every 15 minutes for the first hour, and then per facility protocol, you can go ahead and mark off when you check, just to kind of monitor how much is draining. The second tube is the water seal chamber, which should have 2 centimeters of water in it, and you will notice some slight titling with inspiration and expiration. And then the suction control chamber is the third chamber here, which will be filled to 20 centimeters with water. And your doctor will order what level of suction he may want, and no vigorous bubbling should be present. That will indicate an air leak. Small amounts of bubbling is all right. That ensures that everything's working. And that completes this skill.